What we're trying to do is we're trying to find out the core temperature. There really is not an easy way or a nice way to get a core temperature. So what can we do to get a temperature or to do some pre-screening so that we can follow up with further screening when necessary for someone who might have an elevated temperature as a result of some kind of possible pathogen, whether it be a pandemic type disease. We've seen this with H1N1, SARS, and now with Ebola. So what the standards are trying to suggest are these are the critical pieces that have to be put in place in order to get a proper temperature measurement that we can use to try to suggest what is the core temperature. Yes, I think we should be using this technology. We have set up standards that allow us to get the most precision in the type of measurement, and if we're not using those, then we come up with something less. And that something less puts us at greater risk for missing people that may have a problem that related to pandemic screening. One of the things I've observed on TV is they're using a laser gun much like this one. And this gun actually works with a red dot, but it also gives me a reading of the temperature of the skin. Because the skin is an interface between our core temperature and the environment, it will vary considerably, not only in certain areas, but within a small patch of area. So where I shoot this or where I focus this really have a big difference in temperature. The International Standards Organization uses something more like or calls for a camera like this. This is an infrared camera, and what it does is provides a colored image. And this colored image is actually a colored map of that skin temperature. But more importantly is that we've noticed or observed with research that there's an area called the inner canthus. This is the area right between your eyes, right here in this region, that serves three of your major senses: your mouth, your nose, and your eyes. And because it serves those, the temperature is kept fairly constant and is a good offset reflection of the core temperature. So by imaging that with this camera, we can actually come up with a very good temperature estimate that is an offset of the core. I would say we would be safer because the standards have been set in there in order to get the best and most precise measures we can get. Anytime we deviate from standards, then there's a lot of loose play as far as the results. So I think, yes, we'd be safer.